And now, with further ado, we're really excited to kick off today's session, Pilates for Wellness. This is a class for AML and MDS patients. I just want to let you know that we chose this topic because we know how important it is not to only manage your condition medically, but also to take time to reconnect with your body, release stress, and keep an eye on your well-being. Movement, even in gentle ways, can be a powerful tool to support both physically and emotional health. As I mentioned earlier, this session is being recorded and live streamed. So we completely understand if you prefer to turn off and keep off your camera. But with that being said, if you like to keep it on, Mariana may be able to offer light posture corrections or clarify with movement if something feels unclear. And while this class is designed to be accessible and safe, we always recommend checking in with your healthcare team before starting any form of exercise. And with that, I'm happy to introduce today's speaker and teacher, my amazing coworker, Mariana Castro. She's part of our clinical data team and is also a certified Pilates instructor. She's always on the move, and she's truly passionate about this topic. So once again, thank you, Mariana. And the floor is yours. Literally, the floor is yours.
Hello, thank you. Thank you, Marilu. I'm so happy to be here today. I enjoy events very much, and especially wellness events. So I would like to start today with a brief introduction to what Pilates is before we go into the practice. So I don't want to get too boring on this. Just I would like to just in case that you don't know what Pilates is. This is a discipline that was developed around 100 years ago by Joseph Pilates. Pilates is actually a last name in Germany. He had himself some conditions that prevented him from practicing like regular sports. He had rickets, he had asthma, and some other conditions. So he decided to develop like a special discipline to help him and other persons to thrive. He also practiced boxing and yoga, so Pilates has a lot of influence of these disciplines as well. And over time, this discipline came to America and became really popular. Probably in the last years, it has become more popular even. And yeah, it has. Can you go to the next slide, please? At the beginning, Joseph Pilates named this discipline as contrology, which basically describes the discipline itself, which like the main focus of the discipline, which is control. So it's Pilates objective is to move your body with control and with consciousness. So here we have the 6 Pilates principles, which are concentration, control, and centering. By this, we mean we focus our movements on the core. And the core is not only the abdominal muscles, but also the torso, the muscles that surround the spine, the muscles around the hips, and the muscles around the shoulders. So that's the main objective of Pilates, strengthening the core. So we can have like a better movement in general for daily life, better balance, better flexibility, and strength overall. And then we have also precision. Just for the next principles, we have also precision, flowing movement, and breathing. Breathing is very important when practicing Pilates. Just as you practice, try to match your breathing to your movements. It doesn't matter if I say inhale and you're exhaling, it's okay. Just try to match it. For example, if you extend some at your arms and you inhale, and then when you flex, you exhale. And then try to match the movement across all the exercise. That's the idea, to do it consciously and linked to your breathing. And then just this is a little FYI, Pilates has, because I often hear like, okay, what type of Pilates do you practice? So there is no such a thing like Pilates types. There are several apparatus that serve to practice Pilates. The most basic is the one that we have here, which is a mat. It can be a mat or a towel or anything that you can practice on. But there are also other more like specialized apparatus, like the reformer that you have there in the middle, and then the Cadillac, which is the more complicated one on the right. These are just different ways to practice the same discipline. So the principles are the same, pretty much. The exercises also, some of them are pretty much the same. So yeah, there are just different means to practice the same discipline. And yeah, lastly, I have these pictures of, this is actually Joseph Pilates. These pictures are from his book. Of course, we're not trying to do these postures today, but it's not the posture that we want to do, but the path and to get there, what really counts and what over serves. So yeah, these are very complex. And then why we are here is because exercising during treatment is the way to do it. In the past, the old recommendation while receiving chemotherapy or any treatment for any disease probably was just get plenty of rest, right? During cancer treatment or any treatment. But in the present, this has changed. That is no longer the philosophy. So nowadays, the American Institute for Cancer Research recommends that people actively exercise while they're on treatment for cancer. So can you go to the next slide, please? So today, research suggests that among cancer patients, supervised moderate to intense, actually, physical activity may increase muscle mass, aerobic fitness, flexibility, and even it may boost your immune system, and it is demonstrated that it improves overall quality of life. And it may also decrease fatigue. I know that sounds like paradoxical, but it may decrease fatigue, nausea, depression, anxiety, and many other side effects from treatment. And it's been demonstrated that it may also decrease the length of hospitalizations for cancer patients. So if you feel well to exercise, I highly recommend that you exercise during your cancer treatment. And then just the final recommendations from the American Institute of Cancer Research are, first one is avoiding activity. This doesn't mean just exercise every day or 3 times a week, but also avoid prolonged periods of watching TV or being seated at your computer. So just break down your day and take little walks or around your house or outside, and that's pretty healthy. And then what's recommended is 150 minutes of moderate activity a week, or as I just mentioned, it can be even intense activity if you're fit for that. It can be 75 minutes of intense activity. And then it is also recommended muscle strengthening activities 2 days a week at least. And of course, the recommendation is always begin slowly and carefully and ask your healthcare team for guidance. If you are planning to do the practice today, please just make sure that your healthcare team told you that it was okay for you to work out today. And yeah, that's the introduction. Let's get hands-on.
Awesome. Thank you, Mariana.
Yeah, thank you. So we'll start on a seated position. You can feel free to, you can bend your knees or extend them, whatever that makes you feel comfortable. We're going to start with a neck stretch. Let's do circles. Relax your shoulders, relax your arms. You can close your eyes. And let's do circles slowly to the right. Feel the muscles in the back of your neck, in the front of your neck. Feel how they stretch. And then stop at the and let's do circles to the left. Do this slowly. Then stop in the middle. Then we're gonna do shoulder rolls. Roll your shoulders all the way to the back. Squeeze your blades. And then roll your shoulders to the front. Now, twist your spine slowly to the right. Feel how your spine twists like all the way. Hold the position for a second. Come back to the center and twist your spine to the left. Center. I forgot to mention this, but feel free to play your favorite music while practicing this class. I didn't put any music, so you can hear me better, but you can do that. And then let's just take a couple of nice deep breaths before starting. Breathe in. Hold it for 5 seconds. And breathe out. Once more, breathe in. Hold it. And breathe out. And now, let's make your way down onto your back. Curve your spine and lower slowly, vertebra by vertebra to the mat. Then your arms by your sides. And keep your feet flat on the floor with your knees bent. Now, let's start by finding our imprinted or neutral position for our spine. And by this, I mean active, engage your core, your abdominal muscles. So your lower back, like the curve in your lower back softens. So engage your core. And try to keep it engaged during the whole session. So be very conscious about your core. Extend your arms by the side. Bring your hands to your torso. grab your rib cage, and take a deep breath here. Feel how your lungs expand into your hands. Exhale. Again, try to keep that abdomen and ribcage connection. Try to pull your ribcage towards your hips. Breathe in again. And breathe out. Okay. Now keep your core engaged and extend your both arms up to the ceiling. Your hands should be aligned with your shoulders, and then bring your right arm to the top, and then bring it back. Then your left arm to the top of your mat, and then come back. Then your right one, and we're going to do 4 more. Keep thinking of your abdomen. Your muscles are activated. And last one with your left arm. And come to the center. You can keep your arms up, or you can lower them to the mat. Now we're going to flex your hip, right hip, and bring your knee up. Then extend it to the front. Bend your knee again, and bring it back to the mat. When you do this, try to avoid this rocking of your lower back. Try to keep it as stable as possible by engaging your core. Now, bend your left hip, extend it to the front, bend it again, and come back to the mat. Now, we're going to add that movement to the arms movement. Keep your arms extended to the ceiling, and then flex your hip, extend your right leg and left arm, and come back to the center and to the mat. And then the opposite side. Bend your, flex your left hip, extend it to the front, and extend your right arm. Come back to the center and back to the mat. We're gonna repeat this 6 times. Try to focus on your movement. Try to coordinate your flexions and extensions. Come back to the center. Put to the mat. Bend your hip. Extend. Flex. And come back. More. Flex your hip. Extend leg and arm. Come back to the center. Back to the mat. Flex your hip. Extend hip and arm. Come back to the center. And come back to the mat. Lower your arms to the sides of your body. And then bring your hands behind your head. And we're going to curl up to abdominal curls. And down. Lift your head and shoulders. Try to keep your gaze to the top of your knees. And come back. 3. We're gonna do 4 more. Two more. And now we're combining the legs movement with the abdominal curl. So we curl up with the abdomen, then we flex the hip, extend the hip, bend the knee again, and back to the floor. You can keep your head and shoulders up, or you can lower and lift if you wish. So for now, I'm going to lower and lift. I lower. I lift, flex the hip, extend the leg, bend the knee, and come back down. And I'm up again. Flex the hip, extend the knee, bend the knee, and come back to the mat. Remember to do every movement with control. It's not about speed, it's about control. Come up, stand, flex the knee, and come back to the mat. Last two. Crunch up, extend, flex, come back to the mat. And last one, come up, extend, flex, and back to it. Lower your head, release your arms to the sides of your body. And now we're going to do a pelvis lift. Bring your heels closer to your glutes. You can touch you should be able to touch your heels with the tips of your fingers. And then try to keep your gaze to the ceiling. I am trying to look at you, but keep your gaze up to the ceiling. And then squeeze your glutes and bring them up. And then roll your spine, vertebra by vertebra, all the way to the mat again. This should be all control. Squeeze your glutes and bring them up to a glute bridge. Feel your thighs activating. Feel your glutes and roll your spine all the way back to the mat. 4 more. Squeeze up and lower your back. Squeeze up. Lower your back. Last one, you're going to keep your pelvis elevated, and then lower it just halfway down. Just lower it to the half and come back. This should feel a lot on your thighs and glutes. 4, 3, 2, 1. Keep it up. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And come back to the mat, vertebra by vertebra. And you can hug your knee here and roll your spine side to side. Now, bring your feet back to the mat. We're gonna do the 100, which is Pilates' first exercise in his book. Bend your knees, flex your hips and knees to a tabletop position, like here. It should be 90 degrees on both angles. And then curl your abdomen up. You can keep one hand behind your head and the other one extended to the side. Try to lift your shoulders ahead, and you're going to start bumping with one arm as I count. So inhale, 2, 3, 4, 5. Exhale, 2, 3, 4, 5. Inhale, 2, 3, 4, 5. Exhale, 2, 3, 4, 5. Inhale, 2, 3, 4, 5. Exhale, 2, 3, 4, 5. 10 more. 2, 3, 4, 5. Exhale, 2, 3, 4, 5. Then change your hands, extend your left arm, and start pumping on the opposite side. So inhale, 2, 3, 4, 5. Exhale, 2, 3, 4, 5. Inhale, 2, 3, 4, 5. Exhale, 2, 3, 4, 5. Engage your core. Don't forget your core. Inhale, 2, 3, 4, 5. Exhale, 2, 3, 4, 5. Inhale, 2, 3, 4, 5. Exhale, 2, 3, 4, 5. Last 10, 2, 3, 4, 5. And exhale, 2, 3, 4, 5. Great, done. Lower your shoulders and head and bring your feet back to the mat. If you feel like you need it, you can bring your pelvis again up. So you stretch your hip flexors and then lower your back again. Okay. Now let's go to a side position. You can extend your arm long and then rest your head on your arm, or you can rest up like I'm doing now. Bend your knees at a 90-degree angle. Try to be as stable as possible in your core. Try not to rock to the sides, or to the sides. And then activate your legs and your glutes, and then open your upper leg and then close. Open, close. Breathe. You can rest your upper hand in front of you, or you can rest it on your hips. 4 more. 4, 3, 2, 1. Try to hold it here. Hold it for 10, 9. Squeeze your upper glute. 7, 6, 5, 4, 3, 2, and 1. Now you're going to open the leg, but completely separate even your feet. Before we were just opening the knee. Now you're lifting your whole leg to the top. 2, 4. Inhale. Exhale as you lower. Inhale as you lift. Exhale as you lower. 2 more. Now you're going to hold your leg on top and then start doing little circles to the front. 8, 7, 6, 5, 4, 3, 2, and 1, and circles in the opposite direction. 3, 4, 5, 6, 7, 8, 9, and 10. Extend your leg and then flex it to the front and extend it back. 1, 2, 3. Don't forget your breathing. 4 more. And keep your legs extended. Point your toes, and we're going to do little circles to the front. Come on. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1, and then circles to the back. 3, 2, oh sorry, no. 6, 7, 8, 9, and 10. Hold your legs extended for 5, 4, 3, 2, 1, and rest back. Now, let's go to the other side. Before we switch sides, let's stretch a little bit your the glute that you worked. In my case, it was the left one. So stretch to the side and let's switch sides. So same series on the left side. Bend your knees to the front. They should be parallel, 90 degrees bend, and then open your knee and close. 2, 3, 4, 5, 6, 7, 8, and 10. Leave your leg open, and then we're going to open feet and knees. 2, 3, 4, 5 more. You should be feeling your left glute as well. Last one. And hold your leg lifted. And let's do little circles in one direction. 5 more. There, and then little circles on the opposite side. Hold it there, and then extend your leg to the bottom of the mat, and then flex it to the front. 1, 2. Avoid the rocking of your body. Try to be as stable as possible. 5 more. And last one. Keep your legs straight. Point your toes. We're going to do little circles to the front. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Hold it there, and then reverse circles. 8, 7, 6, 5, 4, 3, 2, and 1. Hold your leg there. Flex your toes. Hold it. 5, 4, 3, 2, 1. And lower your leg and take a rest. You can sit up and extend. Stretch your glutes in the way that feels more comfortable to you. Now, let's go to the mat again. Let's lay on our front. Extend your arms by your side. You can keep your head to the side, or you can try to align it to your mat. And then extend your legs, point your toes, active all your legs muscles, and also extend your arms. And you're gonna try pushing up to the ceiling with both arms. Squeeze your blades as you do this. Five more. You're exercising the back of your body. 3, 2, 1. Hold your arms lifted and then try to twist your hands one side and the other. 3 more. Hold them there halfway and then push again up to the ceiling from halfway. Hold them there. 5, 4, 3, 2, and 1. Lower your arms and take a rest. Take a deep breath. Exhale. Now let's do a nice stretch here. Bring your glutes all the way back to your heels and stretch your arms and your back. Try to reach the front of your mat. And come back. Let's now go to all fours position. Try to align your wrists. If you feel unstable, you can your arms a little so your hands are like. Now come to a plank position. Plank is hard, so lower your right knee and come back to the top. Lower your left knee. This is a dynamic plank. And come back. Lower your right knee. Extend it back. Left. And extend it back. Let's do 4 more. Engage your core. Last one. And hold your plank for 5, 4, 3, 2, and 1. Bring your knees back to the mat. Stretch back again. And let's stand at the end of your mat. We're going to do a little plank progression. You just need to flex your knees. You can do it with your extended knees, or you can flex them as you wish. And then bring your hands to the mat. And then walk your hands to the front of the mat. And then hold the plank for 2 seconds. And then bring it back. And stand up. Let's do some of this. Hold your plank. When you're on a plank, you don't want your shoulders to collapse down. You want to push your mat so your shoulders are aligned and not collapsed. And then come back. Hold 1 2 seconds, and then roll back. Lift spine vertebra by vertebra. 2 more. Hold your plank. And come back. Roll all the way to your plank. Hold it for a couple of seconds. And then come back. Now set your feet mat wide apart. The points are like the toes are pointing to the sides a little bit. And then you're gonna squat and lift your arms and come back up. Squat down and come back. Two more. And you're gonna stay here and then lift your right heel in pulses. 1, 2, 3, 4, 5, 6, 7, and 8. Lower your heel and then lift your left heel. 1, 2. Extend to the ceiling, or you can lower them if this is easier for you. 3. Last 10. If you can do them, you can lift them both at the same time, or you can do one and the other, alternate. So 6, 5, 4, 3, 2, and 1. And knees. Your back all the way to the mat. It's okay if you can reach your knees or your shins or your feet. It's okay. It doesn't matter. For you lift. Just the front. Low back up. And let's sit for a final stretch. Extend your right leg. It can be either to the side or to the front, whatever that feels good for you. And then try to reach your foot with both hands. Bend your left leg and try to reach your foot. To the center, bend both knees, and then bring your body, your torso to the side. Feel that stretch on all the right side of your body and arm. Come back to the center, and now stretch your left body. To the center, we're going to do a spine twist again. Try to go a little deeper than before. Center. Twist your spine to the left. Back to the center. And lastly, try to reach the floor in front of you. Extend your arms as much as possible and lower your head. Feel the stretch on your upper back and or on your glutes and thighs, posterior thighs. Come back slowly. Then take a deep breath. Hold it. And breathe out. Inhale. Hold it. And breathe out. Last one, you're going to inhale and bring your arms up. Exhale. Lower your arms. And this was our practice today. I hope you enjoyed it, and I hope you keep practicing it in the future. Thank you.
Thank you, Mariana. That was awesome. That was really, really awesome. Okay, so I'm gonna go back and share my screen just for a few last minute messages. But first, I want to ask for everyone in the audience if they have questions. If they do have questions, in the meantime, I have a few here. I wonder, for those patients who might be experiencing balance issues or fatigue, do you recommend using a chair or other support while doing Pilates? How can we adapt the movements for them to feel more stable?
Yeah, absolutely. You can always have a chair nearby so you can hold it on like balance postures. For now, I kind of avoided the balance posture. I like most of the exercise were on both my feet instead of just one, precisely to keep balance better. So if you're a beginner, yeah, try to do as much as prefer the exercises where you use both of your feet. And even then you can have a chair nearby so you can hold for balance. Yeah, but absolutely. That's a great question.
Awesome. Also, I wonder, I don't know, sometimes people might hear Pilates and they think of all these postures that you show on the slides. So I'm glad that you share that these are other types of movements that they can do, right? That are on the floor, easy to do, easy to repeat, and they are in a safe space, right?
Yeah, absolutely. It can be adapted. Every time it can be adapted to any, like for beginners or advanced people. So yeah, it is a very versatile
So, and also,
workout.
what are some of the benefits you've seen from regular Pilates practice, even with just light movement?
It honestly helps a lot to keep the stability on in your core. So that's very helpful to avoid falls, for example. When I mean when we lose muscle, which is a pretty normal thing that happens over life, and especially if we are like facing some disease. When we lose muscle, we can that can weaken or the way we walk or the way we stand. So Pilates is a really good exercise to keep the core muscles toned and strong, so we can prevent falls, for example.
Awesome. Thank you. And I think my last one is there one simple movement or stretch that you recommend doing, I don't know, daily, especially for those who spend a lot of time while sitting or laying down, maybe something they can do while watching a movie or reading. There's something extra they can just put on their daily part of their lives.
Yeah, sure. Well, planks are awesome because they activate the whole body, but also planks can be hard. So a variation for planks is instead of being on your toes, you can be on your knees to start, and then you will start gaining strength to do a high plank. So yeah, planks is one, and then the pelvis lift. That's also a good one because we tend to be sitting the whole time. So this is the reverse movement, bring this one, the bridge. When we bring the bridge, the pelvis up, that's kind of the reverse movement that will help stretch our muscles.
Awesome. And what about like the hands or toes, something they can move easily while they're watching a movie, for example, they're sitting at the couch and maybe there's some exercise they can do with other parts of their body that they can implement while watching a movie, for example.
Yeah, any flex and extension of arms and legs will be very helpful. Yeah.
Awesome. I don't know if anyone else have questions. Are the ones that I thought of, but issues I liked. And I love the class. It was really, really good. I will rewatch it to do the exercise myself. But if we don't have more questions, I will move along. But thank you again, Mariana, for this time. We'll learn a lot about where it comes from, how can we adapt it. So thank you again.
Thank you for having me. Thank you so much.
Awesome. Okay, so as you leave the session today, we would appreciate if you could take around 2 to 3 minutes to fill out a brief survey about your experience. Your feedback truly helps us improve and plan for future events. Right now, I will share a quick look of some of our upcoming webinars. So if you're part of our AML community, I invite you to join us this Thursday, May 16th at 3 p.m. Eastern. We will continue our genetic series. This time we will get deeper into FLT3 mutation. We're going to learn what it means and how is it treated. Also, as a quick reminder, Mary just finished our brand new AML podcast series. They are live and they're awesome. We already have 4 great episodes available. They are patient-friendly, easy to listen to, and packed with valuable info. Just as a sneak peek, the first episode explores where is it best to start treatment right away after diagnosis, or is it better just to wait a little to get tests and then maybe choose a better treatment. Episode 2 keeps an eye on AML younger patients, how it different from adult AML. Episode 3 dives into the gaps in treating younger patients and how Reacher is evolving. And lastly, episode 4 breaks down clinical trial, busting myths and answering key questions that you should know. Also for MDS community, we're working on new events, but already scheduled is a session on June 4th that we're going to talk about VEXA syndrome, what it is, and how is it related to MDS. We have many more exciting virtual and in-person events for both AML and MDS coming up, so stay tuned. You can register for all of those using the link at the bottom of this slide. And we will also make sure that we include that on a follow-up email that you will receive in the next 48 hours. And as you might heard, I mentioned in-person events. So this year we're planning on visiting many communities. Connect to Cure is a free in-person event where you can connect with other patients, learn from local doctors, and at the same time discover key resources with our HealthTree team. We already have official dates for the 5 cities here, which are Macon, Peoria, Orlando, Harrisburg, and Fresno. We're still planning for the next ones to define dates, but if you want to learn more about, you can connect with us, you can reach out to us, and we will let you know what a little bit of this event is. You can also scan this QR code to save your spot, and I will make sure to include this also on our follow-up email. As always, we would like to thank our AML sponsor, Cura Oncology, our MDS sponsor, Bristol Myers Squibb Taiho Oncology, without whom this event would not be possible. Just as a reminder, before I wrap it up, I would love to invite all patients to stick around just for a few extra minutes. This time is just an extra time that I set aside for each one of you. If you want to share any feedback, recommendations, say hello, tell me what you like, what you didn't like, and I'll stop the recording, I'll stop the live stream so you can feel comfortable. For the ones leaving, I just want to say thank you again for being part of our community. Your support means a lot to us. And I've included my email on this slide, so please don't hesitate to reach out to me if you have any questions about HealthTree or any of our programs, or just to say hello. I'm always happy to help, and I truly appreciate each one of you. And I hope to see all of you in the next webinar.